Good evening. Welcome to Live United. Here on the show, we have an opportunity to hear about all the wonderful work that goes on in the Monadnock region that makes a difference in people's lives, that supports them, that helps them in their time of need. It may be helping your neighbor, a friend, a family member. And today we have a special show that features Kevin Holfellner. Kevin is from Monadnock Family Services and is the program coordinator for their substance abuse services. Welcome to the show, Kevin.
Thank you, Kelly.
And thank you for being with us. Substance abuse, of course, long time major issue here in the Monadnock region, and one that we're always looking at and trying to make sure that people receive the services they need. Can you tell us a little bit about the history of how that program started at Monadnock Family Services?
Yeah, the program's called Monadnock Substance Abuse Services. It started in 1986. It was a separate entity at that time and funded by the state grant to get services developed in the Monadnock region that can be affordable for people. It became part of Monadnock Family Services in the mid-90s. The focus is, it's an outpatient program. The focus is providing counseling services to make it accessible for the individual, family, and that. It has grown in terms from primary in the Keene area, but we have expanded to not only the western, if you want to call it, region of Monadnock, but also the eastern region. So we're in both locations in Keene and Peterborough.
So I know that people will be able to see the phone number for both locations in Peterborough, here in Keene as well. But it serves communities outside of those two main phone call areas.
Correct.
So I do want you to be aware of that you can call either of those lines if you're on the eastern side or the western side and receive service. You talked about people in need of outpatient service. And I'm guessing with what we see with substance abuse is oftentimes they may be coming into you, may need more than what that outpatient has available. And we know there's some challenges around inpatient care. So I'm guessing that really puts more emphasis on that outpatient piece.
That is correct. Basically, when a person comes into us, we do an evaluation, very comprehensive, and that not only includes substance abuse issues, but also mental health. Because more and more people we're seeing have a dual problems. And from that aspect, we kind of determine with them what kind of services that they would need. So typically, they could have individual counseling. They could be referred to, if there's a mental health piece and a need for medication, to help with that mental health concerns, to our psychiatry department. And if there's further assistance needed developing community resources, they could be assigned a case manager. But as you mentioned, inpatient, that's probably one of my challenges, is when I have an individual from our assessment and working with the person that they need what we call a higher level of care. The challenge is finding those sources for them because it's pretty limited in our state. And of course, helping them with finding the funding for that too.
And we know that a few years ago that was limited even further, that it became more and more challenging to find those inpatient services. I think we only have a couple of locations left in New Hampshire that people can actually go into at this point. Is that correct?
Correct. There's one in Keene through the Phoenix House, and they operate one also in Dublin. But there are some other state-run ones in Nashua, up in Manchester, up in northern area, a program called Friendship House. So state support facilities have shrunk, definitely.
And you mentioned that it can be challenging to get people in there. What's the typical waiting period to get somebody
Okay.
into a inpatient setting if they need it?
It could be months. There's a huge need in our state for people receiving those services, so there's a backlog. And I hate to say this, obviously, if people have funding, it can be a little bit quicker. But depending on state funds, people are in a waiting pattern. And that's where the outpatient really fills in the gap, because then we're supporting them, helping them maintain until they can get into a program.
And I was just going to come back to that, because that really highlights the need for a program like yours, where you're not only filling that gap, but you're perhaps keeping that person sober or clean for an extended period of time while they're waiting for more intensive services. You may also be really filling a need, if they don't need those intensive services, to really support them out in the community. It sounds like, though, that there's an opportunity for perhaps our audience to get more involved in advocacy to make sure that people are really, those services become available across the state and readily accessible. What would be, is there a typical profile of a person that you would see?
Oh, we go the whole range, because under my program works not only with adults, but seniors, all the way to teenagers. The vast majority we see are adults. I do want to note that teen services are limited also for inpatient, vastly compared to adults. But we get the whole gamut from, say, an individual coming in for an evaluation because they're court-ordered, or they're coming in because they received a DWI and they're required, after going through classes for first offenders or multiple offenders, they might be required to do follow-up counseling, as well as the typical individual that does want to stop. So they're motivated, they're coming in for that. But more and more, we're also seeing individuals who are having a co-occurring disorder. I'm referring to a mental health issue, if that's depression, being bipolar, anxiety disorders. So much of the services is addressing, say, a primary problem, their substance use, and also along with that, how to reduce the symptoms of anxiety and depression. It's hard to know what comes first, the proverbial chicken or the egg came first. Many people obviously use substances as a coping tool, so it's kind of like helping them reverse that. What are other more beneficial coping tools? So it really is the whole gamut of seeing people.
And you mentioned that people come in through the, both as an offender possibly. Do you also work with the hospitals, the area hospitals, and really do that screening and evaluation for somebody who's perhaps entered the emergency room?
Yes, and so we would get referrals, say, from Cheshire Medical Center. Well, they have a psych unit, so many times they'll be referred directly from them. Also at the Monadnock Hospital in Peterborough, the State Hospital. Being over in the Eastern region base in Peterborough, we'll get individuals even referred from the hospitals over in Nashua and Manchester, because that's where they went, but they live, say, in Milford, they might live in Jaffrey, New Ipswich, Hillsborough. So we serve that whole region there, so people come from there also.
And it's interesting, you know, part of the reason the United Way supports you is because you do serve such a broad portion of the region, and, you know, all the way up into Hillsborough, which we believe we should be supporting those areas. that are oftentimes kind of on the fringes of the borders and caught
Yes.
between counties and maybe a little bit forgotten. So it becomes more and more important for people to really be servicing those areas. You mentioned that you also oftentimes address the family as part of this. Can you tell us a little bit more about that?
Well, if you go from the basis that addiction affects everybody, or substance abuse or misuse affects everybody, if the individual has a significant other, it's going to affect them. If they have children, it's going to affect them. If they're a teenager, we have parents who are struggling. What do I do with my teen? They just got arrested for a possession charge, so they might come in for evaluation then, and you give recommendations on what to follow through. But it's a systems effect, and expanding on that, it affects the whole community. Affects your employer, trying to help an employee who has a substance use issue, as well as just effects on community resources. So it's pretty wide range here. That's why I like the United Way slogan dealing with united, together, of working together and helping each other out, because if we don't do that, then the problems escalates and becomes harder to deal with.
And that's very true. You almost have to have that sort of web of safety net out there to really wrap around people and assist them. We talked before the show a little bit about the cycling of the different kinds of substances that we see being used out in the Monadnock region. And we had the county attorney on the show recently, and he talked quite a bit about heroin and opiates and the prescription drug issue. We know that's a pressing issue. We know alcohol remains an issue in New Hampshire. We have one of the highest rates in the country of binge drinking and use of alcohol among teens. Can you talk a little bit about what you're seeing and that cycling that does go on, and how we can really, as communities, if we're really going to come together around this, how do we address these kinds of things?
Well, like I've been with the agency for 17 years, and it does, in some parts, go in waves. A lot of that is because of availability. So there might be periods of time where heroin is more accessible, and then when the legal system starts cracking down on it, it becomes less so. Prescription medication, I would say, has become more of the gateway drug. Originally, the core ones are always there, the alcohol, cigarettes, marijuana. But because of our culture, we're so apt to provide medication readily for pain and that, and it's very accessible. And that's why it makes heroin cheaper, because it is. The cost of prescription drugs on the street is higher. One thing that can be of help is periodically things are sponsored in terms of bringing back medications. If you go in your bathroom, you're going to find a lot of meds of still hanging around because people don't finish them, and so they're just there. Obviously, it's easy to grab them, if someone's visiting or whatever. So we always do support the Take Back program. I know here at the police station they have a regular box so people can bring those in right away. But on a periodic basis, that's a program that's offered. So communities can get behind that to help out. I think also it's supporting any thing out there that's about prevention. When I think about cutbacks that has occurred in our state funding, that is a big area that was reduced.
It was actually eliminated.
Correct, it was, and 3 years ago, I think it was. So any support with the community, we as a community can do this in terms of prevention, and the groups are involved with that, because that's part of what I do as an outpatient basis, because you deal with individuals who are coming in, they're not necessarily are addicted or anything, but they might be misusing and abusing, and you want to educate and do prevention work. But that's a big area that the communities can get behind.
You know, especially when I think of teenagers, and I think, you know, the audience knows, in my former life prior to the United Way, I was the area regional director for the substance abuse initiative, and was very involved with helping the take-back boxes come in and things like that. And, you know, it's fascinating because those, I can remember the very first take-back event that we did. People had medications from 1976 coming in to that event, where they had emptied out medicine cabinets, and it's like anything, it kind of gets pushed to the back of your cabinet as new things come in. And, you know, it really does increase the potential for people to be victims of crime. It is one of the main contributors now to break-ins, people looking for those medications in the home. So we do encourage you to get that and get those into the take-back boxes. They're located in different locations throughout the Monadnock region. You can actually go online and see that on the Monadnock Voices for Prevention website. We do have one here in Keene at the police station. There's one in Hinsdale. They're up in Peterborough on that side. So there's a lot of opportunity to get rid of those things. You mentioned the prevention, that whole educational piece. When we think about our teenagers, and you mentioned that that's one of the populations that you now you see. Are you seeing more teenagers?
No, not necessarily. They are a hard group to reach, but majority I see is adults. I do see teens here in Keene, but also Peterborough, and a lot of times people aren't aware how to pick up on the warning signs. You know, they're looking for, are they passing their grades? Has there been any conflicts at school or any conflicts in the community? And it's hard to identify is an individual having problems until it becomes a problem, such as being arrested and that. So for families to get informed and being aware is important. I think it's just that there's been such a aspect of, when you're looking at teens specifically, is this just a phase they're going through if they're rebellious and everything? Because, hey, we were teenagers once and we went through that. And to what extent is substance use is going on? From all the studies, the recent stuff of happening in the Keene, let alone the Peterborough area, for the school systems, it is noted that there is substance use happening. So it behooves a family member to be aware. Thinking of the medications, when I see teenagers, they highlight how easy it is to find stuff because, yeah, they go visit for their friends and everything, and if they're looking for it, that's typically where they get it. Or a teenager brings it and shares it with their friends at school or whatever.
You know, we've heard a lot about things like the farming parties, the different events where, you know, kids go into medicine cabinets. They may be visiting someone. They may go into their family's medicine cabinet. They're pulling out whatever they find in there, sharing them with other people. They throw them in a bowl, and they're taking them, and they don't know whether they're taking heart medication or whether they're taking a sedative or a stimulant, whatever it could be. So there's some real danger attached to that. You mentioned that a couple of things that people could be looking for that could be warning signs. Do you have what would parent or, I'm a parent of a young adult, a college student right now. What kinds of things would we be looking for that may say to us, wow, maybe we need to reach out, have a better conversation with our child or our young adult, and wow, this is a point where perhaps we need to call in some kind of assistance.
Okay. Well, first off, I think as parents, about communicating, being involved in their son or daughter's lives, and reaching out to other parents, be aware. Obviously, teens are going to want to be secretive. They want to be involved with their friends. But I think it's very important that you're aware where they're at and what they're doing. That's always been a given. But warning signs, a lot that you're looking for are at times is mood swings for sure. And yeah, if all of a sudden the person has been involved with a lot of things and they start dropping things from doing, if that's sports or other school extracurricular activities, music, drama, whatever they're involved in, if all of a sudden there's a big shift of interest. If parents also noticing a big shift of friends, and because there will have teens whose friends will start avoiding them, who have been more positive influence if they're starting to be involved in things that are not acceptable from their friends. Obviously, if there's a big increase of being really secretive, that type of stuff, lack of sleep. Part of I try to encourage people to do is take the risk of checking in all the time because it's a healthy risk, finding out what's going on with their son or daughter, and also making themselves really available to talk. And if you are suspicious, there's nothing wrong with checking the rooms, checking everything, finding out if you're finding something. And if you do, just don't pretend it's not there. Address it right away.
So really being proactive as
Correct.
a parent. Now, you also mentioned senior population. And are you seeing some of the same kind of issues? Because prescription drugs, again, have become, in some ways, an answer to many things for us. And there's good things about prescription drugs. I think we're not saying that, they're evil out there. But, there's, when they're abused, obviously it's an issue. But there's many good things about them. But I know in working with the senior population that there's even some challenges there.
Well, it's not necessarily the specific drug they might be on or that they're abusing, but a lot of times they're over-medicated. And so many times the individual will have so many medications they're taking, and is it being followed correctly? So if a person has multiple doctors, for example. The other thing is, as people get older, they tend to maybe be more isolative. So drinking can become a problem with that too. So when you mix the two, it's not good. And those are the key things, because families become more distant. Their extended families might be living in other states and everything, and so there's less of a contact. So it depends on the individual, but usually those are the issues right there when
Now,
they come in.
I'm wondering whether you're seeing more vets at all.
There's a strong vet program in the community over in Marlboro. So at times we will have vets that will be more specifically referred to me in terms of addressing, say, some harsher needs around their addiction. But because of the diversity of vet services now that are being offered, it's become so for myself.
So again, if people wanted to reach out for service, if you gave a couple of tips in there, but if they felt like, wow, I need perhaps more than that, either as an individual or for my family, how would they reach out to you?
Well, I think it's on the screen here that there's a couple phone numbers. They could call the Peterborough office at 924-7236, or they can contact the Keene office at the 357-5270. If they would like to contact me specifically at either of those locations, I will respond. If anything, to give any suggestions or recommendations, that type of thing, of other resources. They can always go on our website, also at mfs.org.
So a couple of ways to reach out to you. And of course, audience, I want to remind you that you always have 211. You can call that, and they will refer you to the services that you need here in New Hampshire. And you can call that from whether it's a cell phone or a landline. You know, you talked about being proactive and really thinking prevention. And you're sort of on the reactive end of things, and the interacting with people when they're in that need place already. When we think about that out in the Monadnock region and the number of people who may be in need, what are ways that people could really get more involved in making things happen around substance abuse? We know we've got a change in the legislature coming up again. Whenever that happens, a change in leadership, it always has an impact on issues like this. We've got local efforts going on. What are ways people could get more involved with this?
Well, you mentioned some of the key ones. I would suggest, like with parents, get involved with your schools. You know, work with the school system, be informed of what's going on. If there's a presentation that's being offered, attend it. Many times the people who attend these things are individuals who are dealing with a loved one or are concerned about someone. And so, you know, if it's not a parent, we tend to think there's no issues going on. But as we've been talking, it's a community effort, and by supporting the whole community, by at least attending a presentation would be very helpful. Contacting, obviously, your local representative of the state, you know, letting them know what your concerns are, if there's some advocacy happening to support that. You mentioned some area things going on, like the Monadnock Area Coalition group. By attending their presentations or things that they've put together, I know there's been some recently at the high school and through the college and that. Over in the Peterborough area, there's a group that's got formulated from through the hospital, and that I'm a part of, that deals with looking at services for the Monadnock region over there for mental health as well as substance use. And I know recently there was a presentation in the Jaffrey area where people got together. It was like a townhouse type meeting, and presenters was there, question answer type stuff, highlighting things. So if you see anything going on, to attend it. Get informed is the big thing for any of us. The more knowledge you have, the easier it is to pick up on the issues and hopefully address them.
You know, we're talking a lot about prevention here and really trying to be proactive so that people don't end up with you. And you know, I don't want to diminish at all the work that Monadnock Family Services does around substance abuse, because the service that you provide is critical for those that are in need and in that that either in a crisis situation or perhaps wanting to change their lives. That service is just so important. And again, I want to really highlight that they can reach out to you through the phone numbers that are posted online. This time of year, we see typically an increase in people wanting to change their lives. Whether it's a New Year's resolution or perhaps it's just they realize that I'm not being the role model or the person that I want to be in my own life or in my family's life. So again, they can reach out. Monadnock Family Services providing such a critical service around substance abuse. Wondering if you have any last messages or a story you would like to share with the community.
Well, I think one key thing to realize for all of us is this is a process that people go through. A lot of times I'm planting seeds, so to speak. That proverbial farmer throwing out the seed, and maybe something was set. Because when we're dealing with issues around substance use, we try to reach the person where they're at the moment. So sometimes it is all about what we call harm reduction. Maybe it's all about reducing what they're using to get a point where they're more safe in their life, what they do. And a lot of times it is then pointing out or them starting to realize how far it's progressed and what do I do about it. So many times people will recycle through. You might see them 1 year and they come back a year later. And they're more impacted. So that I just wanted to highlight that, because if a person's not successful the first time, that doesn't mean they didn't get the message, and maybe that will provide an opportunity for some other time. So there's a lot of hope with that. It is people using all the other resources, because there's the 12-step programs I really am supportive of, which is AA, NA, and everything that's related to that type of stuff, because having as much support for an individual will help them get through the difficult times. I guess that's how I would end.
It's, I had a chance to attend the drug court's graduation the other day, and there was 3 young people graduating from that program in various ages. And what you just said really struck me, because it was about a process for them and a support system being around them, services like yours, services like the drug court. They had multiple, the House of Corrections. And, as I sat in that room and looked around, there was probably close to 75 people in attendance at that graduation. And whether they were family or, in our case, we were there because those folks had been involved with community service and had been huge contributors out in the community as volunteers. With the United Way, and really looking at how do they make up for some of the mistakes they've made out in the community. But there was just a wide range of people that provided that safety net and that support system. Folks from MFS, folks from the state, judges. It was just a real mixture. So I think you're right, that it really does require all of us coming together, really thinking about how we support a person through this process. Then we have critical services like yours through Monadnock Family Services that can be there, that help create that safety net. It is important to support all of those things so that we can support the individual's well-being and the family's well-being out there.
There's that saying, to raise a child takes a community. I think for any of us, it takes a community to take care of each one of us, not just the child. And we all go through phases of life where we do need that support. So, you're preaching to the choir here.
I know I am.
Really...
And, I really want the audience to hear that, because I want them to hear that we do have services out there. But those services can only meet the need with your support. They only meet the need for a small portion of what needs to occur for an individual or a family. And that you become a part of that. And that's what Living United is about. And, you know, it's why we do this show, because we want people to see that it's important for all of them to be involved in that giving, that advocacy, that volunteering, really being part of that safety net. We can have a service like the Monadnock Substance Abuse Services, but as a standalone, it can't change a person's life. It has to have other support systems out there. A critical piece of it, of that safety net, again. So I want to really highlight that. I want to thank you for the work you do out there, and the support that it provides in the Monadnock region for people. Remind our audience that if you know someone in need, or if you are in need of Monadnock Substance Abuse Services, you can reach out to them through their Peterborough and through their Keene office locations, through Monadnock Family Services, and also through the mfs.org website. You also can call 211. And 211 will direct you and connect you to the services. We're also fortunate here in the Monadnock region to have Monadnock Service Link. And folks can reach out to Monadnock Service Link, and they will again connect you to Kevin and the services of Monadnock Substance Abuse Services. I want to remind you, audience, to remember to give, to volunteer, and advocate. I'd again like to thank Kevin for joining me today. And I remind you to live united out there. Thanks for joining us.